So hello everybody out there, Dave here again. I wanted to make this video because if you've watched any of my videos, or even if you're new to my channel, I talk a lot about how I'm a nurse. I've worked in the medical field for over a decade. And one of the things I wanted to talk about that I've begun to notice is something, called changing demographics. And what I mean by that is I've done a lot of work throughout the medical field, hospitals and stuff, but now as I'm getting older, I've kind of switched to where I work mostly in like skilled nursing facilities. And like skilled nursing facilities are like nursing homes where like on one side of the building you have long-term care patients, and then on the other side of the building you have like a rehab for people that just got out of the hospital and things like that, or had falls or injuries or a whole myriad of issues. But the one thing that I wanted to talk about today was I've noticed, since I've been in the field for a while, I've noticed a lot of the majority of the World War II elderly people have all pretty much died off. I think at my facility, I only have maybe 3 patients that are in their 90s, and the rest of my patients are anywhere between, say, 55 and 80. And one of the things I wanted to talk about is I really miss the World War II generation old people, the geriatric patients, because those people, they dealt with World War II. They grew up through the Depression. You would go into their rooms and they would tell you stories, and they were the nicest, most kindest people. You'd go to help them. They'd be like, oh, that's okay, honey. I don't need no help. They were so independent, and they were so, just pleasant, independent, strong people. But now, the majority of my patients are aging baby boomers. And this baby boom generation, these people are horrible. They're horrible. I've noticed over the last, especially the 5 years, the majority of patients that I have are baby boomers, and they're angry. They'll cuss you out in a minute. They're so entitled. They think that you owe them something. And the other thing is how sick they are. Like, the years of processed foods are doing a number on the baby boom generation as they age. I have a patient now who's 97 years old. So she would fall into that World War II generation. And this lady still takes herself to the bathroom. She still keeps her room clean. She still does everything. She, very pleasant lady. Every night when I go in to give her a medicine, she always says, thank you, Dave, thank you. Very sweet lady. Hardly on any medication, a couple little medications here and there, but not a lot. But this baby boom generation, Jesus, these people, once they hit their mid-60s to 70, they're incontinent, they can't get out of bed, they're overweight, they have horrible diabetes, horrible heart failure, horrible congestive heart failure, horrible lung ailments, horrible skin ailments, just a lot of diseases which I equate to horrible diets. Obesity, big time, joint pain, on all kinds of medication, pain pills out the ass. And then they're the most unpleasant people. And I always think it's funny because, you get mad at me. I would like to explain to people when it comes to nursing homes the way things work. Now, I know when you're in the hospital and you're getting ready to go to a nursing home, the nursing home tells you everything that you want to hear. They tell you like it's a five-star resort. But I promise you, it's not. Number one, we do not have a pharmacy in-house. All of our medications we have to order. So when you first come to us and I do your admission, I have to order your medications. When you come to me, and if you're on a pain pill, I don't have it. And you may say, well, a lot of people go, well, you have an E-kit. An E-kit isn't like an emergency kit where we have medications. But because of the opioid crisis, a lot of, especially the company that my nursing home deals with, unless I have in my hand a paper prescription for that opioid, I can't pull it out of the e-kit. And a lot of times when these patients come in, like 99% of the time, I may have a doctor's order from the hospital or from wherever they came, but unless it's a prescription that they've been on for a long time, I can't pull it out of the e-kit until I get that prescription from the doctor. And one of the things that I think is really funny is they'll call, like literally call their families, and then their families will call me and bitch at me. There's nothing I can do. There's nothing I can do. I just work there. Like the facility I work at, like a lot of facilities are starting to do this. The facility I work at, we don't provide walkers or wheelchairs. And I'd have patients come from the hospital and demand that I give them a wheelchair or a walker. Lady, do you think I keep that stuff in my car? I just work here. I don't own the place. You know, you have to provide that. A lot of businesses, nursing homes are doing that now because it's an extra cost that they don't want to have to burden, you know, it'd be burdened with. And, you know, one of the things that I think is really funny is, you know, how we've always described as getting older, the golden years. Well, one of my favorite sayings is human beings don't age like fine wine. We age like milk. And this baby boom generation, for their lifestyles on processed foods for 70 years and obesity and everything and drinking alcohol and just eating all this sugar, they're horribly sick. And you know, I literally had a patient a couple of nights ago. She called 911 because it took too long for somebody to answer her light. Lady, I only have the staff that I have. You know, if my staff is passing trays or doing something else or giving showers, you got to wait. And this is what I'm talking about. They're so entitled. They feel like I literally had a patient tell me, you know, like for example, at night when I work, I have average about anywhere between 30 to 40 patients that I take care of. And I had a patient one night getting all mad about her having to wait. And I told her, I said, lady, you know, I got 40 patients. I don't give a shit about them. Well, lady, they don't give a shit about you. You know, and last night at work, I had a lady complaining, who's a boomer, complaining about the lady next to her room, TV too loud. And I told her, I said, this is not your home. These are not apartments. I cannot force a patient to turn off their TV. If she wants to watch TV, I can ask her, but I can't make her. And it's like they're so entitled that they think that like everything is owed to them. And it's not. It's not. And I have a feeling that this baby boom generation are going to find out the hard way that growing old in America under America's medical system is a horrible experience. I see it every day. That's why as a nurse, and a lot of nurses have expressed this sentiment to me, is I've heard nurses say, I'm scared to get old because they see every day these patients and what they go through. Like I'm literally to the point, if I get to a point where I'm a burden on my family, that's it. I'm not dealing with that. I'm not going to live in a nursing home where you have to lay in your piss and your shit for hours because nobody comes to work anymore. Especially on holidays, nobody comes to work. The management doesn't give a crap. I've had management call me when I was short. Like I'd call the on-call and I'd be like, hey guys, you know, I don't have no CNAs or whatever. Oh, do the best you can. That's all they tell me. And for example, I'll give you a good example. About 2 months ago, I caught COVID. It was no big deal. I was better in 3 days. But, you know, my facility has a thing that if you catch COVID, you got to be out till you test negative. Well, I tested myself because I knew something was wrong, and I tested myself, and about 11 o'clock at night, so I've been at work for about an hour because I work the graveyard shift, and I tested positive for COVID. So I started trying to call my DON and my on-call number. Nobody would call me back all night long. Left them multiple messages because they don't care. And then the next morning, you know, when my administrator came in, I said, hey, I just want to let you know, this is my COVID test. I tested positive. I've been trying to call y'all all night long. But I had to pass meds this morning, so everybody on these halls had been exposed. And then they were like, oh my God, but they don't care. So I just wanted to make this video about changing demographics, and I wanted to tell the baby boom generation, there's a thing that we have, especially at the nursing home. It's called AMA, Against Medical Advice. If you think you're going to come to the nursing home and you're going to be catered to, and people are going to kiss your feet, and they're going to just do everything you ask them, and everybody's going to answer your line in 2 seconds, you're living in a fantasy land. You're living in a fantasy land. Like, I may be the nurse, but as the nurse, I cannot do anything without a doctor's order. I don't care what the management told you before you came to the nursing home. I can only do what I have as an order. I don't care what the hospital did or anything, because it's a nursing home. A nursing home is different from a hospital. So I have a feeling that this baby boom generation is in for a rude awakening. So if there's any other nurses out there, please comment on the video. Give me what you're seeing out there. And like I said, I'm really missing that World War II generation. Those were some strong, independent, sweet people, and I hate to see that they're all dying off. Well, this is Dave, Zoe Zizzles. Make sure to like and subscribe. Bye.